Welcome back. We're talking with Dr. Spencer Berry about reversing type 2 diabetes, but we were just talking about, instead of reversing it, the much easier option is preventing it.
Well, yes, we would certainly rather, and a lot of folks in our area have probably seen the signs, the billboards on the highways that say 1 in 3 Minnesotans is pre-diabetic. And you're hearing these numbers and many others. The thing about diabetes is that it is a spectrum disease. It starts before you actually are diagnosed. Many folks are familiar with the term. They say, well, I went to the doctor, or my dad did, and they said they were borderline. You hear that term a lot. And basically, it's a disease that you become progressively sicker, but before you actually get the diagnosis, there's probably a 5 to 10 year run up to that disease, at any which point, if you intervene nutritionally and help folks learn what they need to do, they can prevent it.
But what does it mean to be pre-diabetic?
Pre-diabetic means that your body's response to handling blood sugar is not normal. It hasn't reached the degree to which we call it diabetes, but it's just increasing levels of abnormality. And because of that, you end up running a higher blood sugar, and high blood sugar is actually, believe it or not, a high blood sugar is what causes blindness, kidney disease, the pain that you'll hear diabetics talk about with their feet and hands, what they call neuropathy, and then ultimately that inflammation, which then leads to stroke, heart disease, and a variety of things that go with. This can all be prevented. About 85%, up to 85% of type 2 diabetes can be prevented. And that's one of the things we work to do at the clinic every day. And we see patients, and we diagnose many with prediabetes that have not been diagnosed, and there's a big move now to have that done. When you go to your doctor, people should be asking, can I have that test for prediabetes? The hemoglobin A1C is the test. It's very easy. It's an easy blood test. Doesn't even have to be fasting. One that can be used to help screen and let you know if you're pre-diabetic. And we're starting to see that now more and more, even in our children and teenage patients that are starting to have prediabetes. And so if they develop diabetes, full-blown diabetes, when they're 18 and 20, they're going to start seeing the problems that come with this, the heart disease, the kidney disease, by age 40, 45, and 50. And again, much earlier in life, and the emergency rooms and our hospitals are already seeing that burden.
Let's say I'm type 2 diabetic, I come see you, get on a new nutrition plan. Am I reversing it in a week, in 12 months?
That's an excellent point. Generally, you'll start to clear out, within 7 days, you'll start to clear a significant portion of the fat that's within the liver, which is causing the abnormalities there. It takes about another couple of weeks or so, 2 weeks total, for the pancreas, which is the organ that produces the insulin, to clear that out. And then over time, or even upwards to a month to 2 months, then after that period of time, as patients then learn the feeding long term, they have the same response to blood sugar with their pancreas that non-diabetic patients have. So these folks, so the answer is roughly a month for the liver, maybe up to 2 months for the pancreas itself. And like I said, the studies will show this in patients who've had diabetes up to 6 years now. And so by preventing that ahead of time, patients get benefit very quickly. And then as we show them sustainably how to live in a fashion, because again, we're not asking them to do something that's weird, strange, and unusual. We're just asking them and showing them, better than that, showing them how they can accomplish this in their life and helping them with that. And it's just, it's tremendous to see as patients find that something they maybe thought was out of their control and that was going to lead to health issues that, you know, they've watched it in their folks or in their relatives, and now all of a sudden they're like, wow, I can avoid this. I can avert this, and now I feel better than I ever have. I'm not, I'm not spending $300 and $400 a month buying insulin and other medicines. I mean, it's amazing. It's amazing.
Good stuff, Doc. If you want to find out more, check them out at FargoMedicalWeightLoss.com. Again, FargoMedicalWeightLoss.com. And stick around. You're going to see some, I think, some diamonds, or at least some jewelry on Christy right after this.